I'm Dr. Hillary Hushauer from Rangeline Chiropractic. I'm hopping on in the group to talk to you about chiropractic care and how it can help your kids with sleeping issues. So I'm sure that as parents, you've had problems with the kids going to sleep, sleeping long enough, maybe even for yourself too. I think a lot of this will be interesting for you, for your kids and babies, as well as maybe yourself too. So the two main things to think about are the parasympathetic nervous system and sympathetic nervous systems in the body. So as chiropractors, that's what we do all day, every day, is deal with the nervous system. So we've got a parasympathetic nervous system and a sympathetic. The parasympathetic is, I want to sleep, I want to eat and digest and rest. And then the sympathetic is go, 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 go. And you've probably heard of like fight or flight mode. That's what sympathetic is. So what I find a lot is my patients are high dominant in sympathetic, go, 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 fight, 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 fly, 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 and then we're low in the parasympathetic. So what the goal would be to equal them out, right? So how do you do that? Actually, your chiropractor can help with that. So we adjust the body. There's two main areas to adjust to improve your parasympathetic nervous system flow, and that is the first bone, C1, also called atlas. So if you're ever in jeopardy, now you know the special word for the C1 is atlas, okay? Atlas is the first bone, and if this is crooked just a little bit, that can affect every single nerve in your body. And that is primary goal right here, is to help with your parasympathetic nervous system. The other one is in the tailbone, or also called sacrum. Also good note for you in case you are ever on jeopardy, so you know that it's not called your tailbone, it's called your sacrum. So that area can also affect your parasympathetic nervous system. So a good chiropractor would check those two areas if your main complaint was, hey, my daughter, son, spouse, etc. is not sleeping well. What can we do to help? Those are my two go-to spots. And I would say more times than not, it's the first bone, the C1, also called atlas, that's out of alignment. And it could just be something little or it could be something big. So then patients might ask me, well, why would my baby have that out of place, right? It's a baby. Why would their bones be out of alignment? And then my thought would be, how were they born? Was it traumatic? Did you have to push a giant baby out of a small opening? Maybe that could cause it. Was it a C-section? Maybe they got pulled, their little head. Maybe they got stretched. I mean, I think the possibilities are endless of like why it could be out of place. The main thing is to assess it and fix it. Another question patients ask me, well, it's just a baby. How would you adjust a baby? I don't want you to pop their neck, obviously. Things have come a long way since, the past 120, 30 years that chiropractic has been around. With like babies and infants and maybe some smaller toddlers, I will just gently push on the bone back in the direction it needs to go. And that's something that I know through my training. The other way is to use a little tool called an activator, and it makes like a little clicking noise, kind of just clicks the bones back into place, so gentle. I would say the majority of babies are sleeping while I do this actually, and the kids don't really care. They can sit on the table, sit on mom, lay on mom. I mean, not a big deal. I've literally adjusted kids on the ground. It's not like my kids are very easygoing either. I tend to adjust them when they're in their bed right before they go to sleep. That way it helps them sleep better. So how do we know that chiropractic would help? Well, you just kind of need to go and get assessed. I think that every baby should be checked out after birth just to see what's going on, because we're not going to tell you, like your spouse is going to tell you that he's not sleeping well or that they have neck pain. We just have to find it objectively. So I just have to go and feel and say like, oh, things are in place, or oh, they're not. Do they also have problems sleeping? And then you're like, my patient's like, how'd you know? Or if their sacrum's out of alignment, a lot of times they have constipation issues. And I go, how often do they go? And like, not often enough. So like those are things a good chiropractor can look at and assess for you. So you may not know for for certain if chiropractic can help. It's kind of like this would be a great natural thing to check out and avoiding anything else that's unnatural. So with adjusting the spine, we're going to increase the parasympathetic and decrease the sympathetic. So we're going to have less of that fight and flight and overstimulation of the nervous system. So that is why I also said this could be something interesting maybe for you and a spouse or other kids. So it's not necessarily just for kids. There's a lot of us that are sympathetic dominant, which you may have heard that term before. And that is when that part of the nervous system is just in overdrive. Your brain is constantly going, you're just all around. Maybe you have heart palpitations, maybe you have high blood pressure. These are some symptoms. Maybe you don't digest food well, you don't sleep well, you're anxious, you have anxiety. These are good symptoms that perhaps you're in sympathetic overdrive, and that's what chiropractic can help with. Another question patients ask me is, all right, I'll come in. How much is this going to cost? How long is it going to take to fix? When will I notice the difference? Some of the babies notice it instantly. The parents of the babies notice it instantly. They are like, she slept so well. It was amazing. Perfect. That's what we want. I know that when I adjust my kids at night before they go to bed, if they've had a rough time or they're cranky and irritable and, they may be fallen too many times, I'm like, you know what? Let me just check your neck before you go to sleep. I'm fine. Okay, look, you're just gonna lay there, I'm just gonna check it. One little quick adjustment, and they're getting into that deep REM sleep. They're not gonna get woken up as much. I don't know if you've experienced it too, but kids can experience it too, where they're not getting into their REM, that deep sleep cycle. And again, that's what chiropractic can help with, is changing that sympathetic and parasympathetic nervous system stimulation. So as far as like, how long does it take? It could take one visit. Could take 6. It's hard to tell. It depends on the person. Children, especially babies, are easier to fix than it is adults. I know, big surprise. Another question I might get asked is, well, I don't have a baby, but my toddler has a hard time sleeping. Could it, why? That just started up. Okay, well, were there any recent head injuries? And if it's a toddler, I'm just gonna go, yeah. How many times do the kids hit their heads on the wall, or the floor, or anything in proximity to their head? And I think that floor didn't jump up and bite you, or the corner of the house has always been there. How did you hit your head on it? I'm just saying those little things over and over and over. Those are the things that cause trauma and can misalign the neck. So we've got several hundred falls, thousands of falls over a toddler's lifetime. You've got maybe even poor sleeping posture. Most of the kids do not need a pillow. So talk to your chiropractor about a pillow size. They actually do make little pediatric ones. I have a little one for my son. He's 5, and it's just this thick. I will not let him use an adult size pillow. That would be ridiculous on his little neck. So, maybe it's the wrong pillow size if you even need a pillow at all. Most kids and babies and toddlers don't need pillows, but talk to your chiropractor, because it does depend on body size, and it depends on the alignment of the neck and what maybe you've been working on before in the neck. So it's kind of subject to each individual child. So check with them on that. Also, what if they're in pain? The babies and kids do not have pain receptors like we do as adults. They're not fully developed. So what is pain to us, they might not register, but they know they're uncomfortable. They know they're not sleeping well. They're cranky, they're irritable, but they're not going to say, I have pain in my neck. So again, just getting to your chiropractor and getting everything checked and lined up if needed, that's really more of a preventative thing. I know at our office we do weekly kids weeks where we do even free assessments on kids, and sometimes we do discounted adjustments, because the negative thing about insurance is that they don't often cover preventative care. I know, shocker. But a good chiropractor is worth it. So wherever you are, find a good chiropractor, pediatric chiropractor, someone that either specializes with kids and babies, or that's maybe their primarily goal. Your kids will feel comfortable going in there, and it's definitely well worth it. So I hope that some of this information was knowledgeable for you. Remember, chiropractic care, we're going to increase the parasympathetic and then decrease the sympathetic to make them more level. So less fight and flight, less relax, sleep, and digest. So have a great day. Feel free to reach out to me. Always happy to help no matter where you are in the world.